Guys, welcome back to Medical Coding with Blue. Today we're going to be talking about sequencing, and I want to thank the viewer that brought this up because this is very important to understand and know. How do you decide which diagnosis to sequence first? I'm going to give you a little illustration today, so hopefully this will help answer those questions, okay? In this scenario, the patient had been in a motor vehicle accident. They have a left femur fracture and a left arm abrasion. They also have a left 5-centimeter cheek laceration. They are diabetic type 2 that is well controlled on long-term use insulin. They also have high cholesterol and are on a cholesterol controlling drug. Okay, there's a lot of them out there, the cholesterol controlling drugs, so I can't really think of one. So let's just leave it like that, okay? So they are on 2 different medications for these diagnoses, okay? So how do we decide which of these to code first? Well, the patient has diabetes, so that is pretty serious, but that's not the reason that they're coming in. The reason that they're coming in is because of the motor vehicle accident. They were injured in this motor vehicle accident. We have 3 injury codes to look at: the fracture, the abrasion, and the laceration. So of these 3, which do you think is most critical? The fracture, the abrasion, or the laceration? If this fracture is not looked at and taken care of, this could be very detrimental to the patient because obviously this is a fractured femur. This is like one of the most biggest bones in your body, and it's fractured. They cannot run around like this. So if they don't get it looked at, it's detrimental to the patient. Okay, so this is going to be your first listed diagnosis code, which is that femur fracture code. Okay, you also have the business of the arm abrasion and the 5-centimeter cheek laceration. Of these 2, which do you think is more detrimental to the patient or more serious? Okay, the laceration or the abrasion? The provider can look at the abrasion and say, okay, we can just clean it up and everything's going to be okay. But this 5-centimeter cheek laceration, that's pretty serious stuff because this is 5 centimeters on your face, you know. The provider may have to call in plastics, or they may have to do extensive debridement because this patient was in a motor vehicle accident. There was glass and everything flying and gravel probably. No telling what's in that laceration. So of those 2, the abrasion and the laceration is much more serious. So that's going to be your number 2 diagnosis. Now, the decision to do number 3 as the arm abrasion, that's pretty well straightforward because of those 3, it's number 3. Then we have your motor vehicle external cause code. Now, just for the purposes of this illustration, I'm saying that that's the number 4 slot. It depends on what facility that you're working in, because some facilities will have you code all of your diagnoses codes first, and then your external cause codes, if there's any, will anchor at the bottom along with your long-term use medications. So, like I said, it really does depend. And sometimes in some facilities, they'll have you have it as up there with the injury code. So it really does depend on where you are, all right? So, but in the purposes of this illustration, we're going to make that MVA external cause code number 4. Now remember, the external cause codes are never first listed. Don't ever list those first, okay? There's been some stories about people who have listed those as first, and I understand because that's the reason that the patient came in, because they were injured or they were in a motor vehicle accident. But that's not going to be what is bringing the patient in. They're not going to treat an external cause code. They're treating a injury. So your injuries are going to go first, followed by the external cause code. Okay, so that's your number 4 diagnosis, is that MVA code. Okay, according to this scenario that I'm making up. Now you have the business of the patient being a type 2 diabetic that is well controlled, the insulin and the high cholesterol with the cholesterol controlling drug. Okay, so you have those 4. Let's take the medications out of play, okay, we have the two diagnoses, which is the diabetes and the high cholesterol. Which of these two do you think is much more severe to this patient? The patient is a type 2 diabetic. If their body gets stressed out, it's going to spike their blood sugar. The provider has to think about that, okay? That's one of the things that they have to consider. Because if the patient's blood sugar goes high, they can't give them a steroid shot because it'll really skyrocket their blood sugar. So of those two, the diabetes is much more pressing, okay? So that's going to be your 5th listed diagnosis, is that diabetes, okay? And then obviously the high cholesterol right behind it at number 6. Now, of the insulin and the Lipitor, which would you code first? I would code the insulin because it is related to the diabetes, which is listed first. So I would just figure it that way. So they followed by the insulin and the cholesterol controlling drug. Okay, so you got your 8 diagnoses there. Easy as pie, right? So you always kind of want to anchor your diagnoses that are like your status codes, like your post-procedural codes or your long-term use medication codes. You want to anchor those at the end because that's not really what the provider is treating. It is helpful to know this because it helps with their medical decision making to know all the drugs that the patient is on, just in case that there's any interaction. But that's how you want to kind of think about it. So all of your long-term use medications and all of your status, your Z codes, those are going to kind of go towards the end. Now, there is a section in the ICD-10 book that does tell you which of the Z codes are your primary listed diagnosis, like Z01818, which is the pre-op appointment. That's going to be a first listed code because that is the reason that a patient would come in, is for a pre-op appointment. So in that scenario, you would code the Z code, the Z01818, for the pre-op examination code, and then followed by whatever they're going to have the surgery for. So look at it like that. There's just a lot of things to it, but once you start exploring your ICD-10 book, you'll be able to see what I'm talking about when it breaks down into sections, you know, which Z codes are primary listed, you know, what are your drug classifications, and of course it has your pharmacology section in your ICD-10 book. So be sure to check that out. This is why I say go through that book forward and backward, because it will help you. And it'll just kind of give you a better understanding of the severity of things. And there's a lot of great little examples throughout the ICD-10 book. So this way you can see what the book is telling you is a proper way to do coding. Okay? So I think a lot of times, especially with veteran coders, sometimes we get into a kind of a rhythm of doing things and not really kind of looking at the book. So this is why it's important to kind of always stay on looking at the book. You should always continue to try to better yourself and learn as much as you can, because the book does get updated every year. So you have to think about that too, because when it does get updated, sometimes it's not visible right away until you start really going through the book and saying, oh, wait a minute, this is new. So just be sure to pay attention to those little things. It's all about the details, my friends. All about those details. All right. So that wraps up today's episode. I hope that explained sequencing a little bit better for you guys. I know it does get confusing, so. But I will be trying to work out some scenarios that will kind of talk about this more, so this way it'll get a little bit easier for you. Okay? Well, I will see y'all on tomorrow's episode. And if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe to my channel and follow me on my adventure in medical coding. All right. I hope y'all have a great evening, and I will see y'all tomorrow. Bye.